Our bodies are these incredible, complex machines, right? Just full of hidden systems all working behind the scenes to keep us going. But what happens when one of the most critical supply lines, this hidden highway feeding the very back of our brain, runs into a major problem? Well, today we're diving into the vital and surprisingly vulnerable world of the vertebral artery. So let me start by asking you a question. Have you ever really thought about how the parts of your brain that control things like balance, your vision, your basic coordination, how they get their fuel? It's actually not the famous carotid arteries you always hear about. Nope, there's a whole other system at play, and when it fails, the consequences can be, well, they can be really severe. And just how severe are we talking? Get this. Problems in this one system are responsible for a staggering 25% of all ischemic strokes. That's the kind of stroke caused by a blockage. 1 in 4. So you can see why understanding the system isn't just some academic exercise, it's absolutely critical. So welcome to what doctors call the posterior circulation. I like to think of it as a superhighway, powered by the vertebrobasilar arteries. Its whole job is to deliver that precious, oxygen-rich blood to the absolute control centers of your brain. The brainstem, the cerebellum, which handles movement, and the occipital lobes, which let you see. Okay, so to really get a handle on what can go wrong, we first need to look at a map of the highway itself. We're going to take a little journey along the vertebral artery, and you'll see it's divided into 4 very distinct zones. Each one has its own unique layout and its own unique dangers. So, what is this vertebral artery exactly? It's pretty simple, actually. You have 2 of them, one running up each side of your neck. They travel upwards and then, and this is the cool part, they join together inside your skull to form one single, super important artery called the basilar artery. That's the main road of this whole posterior superhighway. Our journey kicks off at zone V1. This is the very beginning, where the vertebral artery branches off another major artery, the subclavian, deep down in your chest. Now, just like a busy, congested on-ramp to a highway, this is the most common spot for plaque, that nasty buildup of fat and cholesterol, to cause a traffic jam right from the start. Next stop, zone V2. Here, the artery ducts into this protective bony tunnel that runs right through your neck vertebrae. Now, that sounds great, right? A nice, safe channel. But it's kind of a double-edged sword. While the bone acts like a shield, it also means that things like bone spurs can grow and actually squeeze the artery, choking off blood flow. Then we get to zone V3. The artery pops out of that bony tunnel and has to make some really sharp, flexible curves to get around the very top vertebrae in your neck. This amazing mobility is what lets you turn your head, but that flexibility comes at a price. It makes this section the most common place for something called a dissection, which is basically a tear in the artery wall. And finally, we hit zone V4. This is the last leg of the trip. The artery passes through the base of the skull, and inside, the 2 separate vertebral arteries meet up and merge into that single basilar artery we talked about. The superhighway is now complete, and it's ready to feed the back of the brain. All right, so we've mapped out the highway. But what happens when things go wrong? When the flow fails, it's usually for one of 2 big reasons. You can think of them as massive traffic jams or dangerous road debris. So on one hand, you've got low flow, or what's called hemodynamic failure. This is your traffic jam. A really bad narrowing in the artery just doesn't let enough blood get through. This can cause temporary symptoms, like getting dizzy when you stand up. On the other hand, you have embolic events. This is the road debris. A little piece of plaque breaks off, goes flying downstream, and gets stuck in a smaller vessel, causing a total blockage, and that can lead to a full-blown stroke. So which of these is the more common culprit? Well, when you look at the data from hundreds of patients, the picture becomes pretty clear. Large artery disease, or traffic jams, that's about 1/3 of the cases. And then embolisms, the road debris coming from the heart or the arteries themselves, they make up another 42%. You put those together and you're looking at over 70% of these strokes. They're the big players for sure. Now, this is the part that might really surprise you. When we think of strokes, we usually picture older folks, but this is where vertebral artery disease is just shockingly different. As the research points out, a vertebral dissection, that tear in the artery wall we mentioned back in zone V3, is a major cause of stroke in young and otherwise totally healthy people. And this just shows you how fragile that artery can be. The things that trigger a dissection aren't always some huge car crash or major trauma. Sometimes they can be seemingly tiny everyday things, practicing a yoga pose, painting a ceiling, having a really bad coughing fit, or even just a violent sneeze. Any sudden movement that snaps your neck back or rotates it can be enough to do it. Okay, so the risks are pretty serious and clear. So how do doctors figure out what's going on? And more importantly, how do they restore that critical connection to the brain? Let's take a look at the warning signs and the solutions. Oftentimes, the body sends out some pretty classic warning signs of what's called vertebrobasilar ischemia, or VBI. These are things like dizziness, vertigo, seeing double, numbness around your mouth, and even something called drop attacks, where a person just suddenly loses all muscle control and falls down, but they're still conscious. If someone's got 2 or more of these symptoms, the odds of it being VBI are pretty high. So once a diagnosis is confirmed, surgeons really have 2 main schools of thought for how to fix the problem. You've got the classic, time-tested approach of open surgery, and then you've got the newer, less invasive method called endovascular therapy, which, believe it or not, works from inside the artery. Let's just compare them for a second. Open surgery, well, that's what it sounds like. It means making an incision in the neck to go in and physically clean out or even reroute the artery. It's definitely more invasive, but it lets you repair it directly. Endovascular therapy, on the other hand, involves threading a tiny catheter, usually from an artery in your leg, all the way up to your neck to place a stent. It's way less invasive up front, but it comes with its own unique set of challenges. So here's the million-dollar question. How do these repairs hold up over time? When you look at the data on long-term patency, which is just a fancy way of saying how well the artery stays open, it's pretty revealing. For those blockages right at the beginning in V1, open surgery has an incredible 5-year success rate of over 95%, though it does carry a small risk of nerve injury. The big risk for endovascular therapy, though, is something called restenosis. That's where the artery starts to narrow down all over again, and that's a pretty significant long-term worry. And I mean, the durability of that classic approach is it's impressive. For that really common V1 reconstruction, open surgery has a 10-year patency rate of over 91%. Think about that. 10 years later, it's still working. That is a remarkably durable fix. So this all leads us to the final critical decision. It's not really about which procedure is just better across the board. It's about which one is better for a specific person, with a specific blockage, being treated by a specific surgeon. It is all about balancing the fix. And that, right there, is the key takeaway. For every single patient, the medical team has to weigh all the evidence. They have to carefully balance the proven long-term durability of an open surgical repair against the much lower initial physical impact of an endovascular procedure. The right choice is never one size fits all. It has to be a personalized decision. And this all leaves us with a much broader question, one that goes way beyond just this one artery. In this age of really rapid medical innovation, how do we best balance the exciting promise of new, less invasive technologies with the hard-won, proven reliability of classic techniques? That's the challenge, and it's right at the heart of modern medicine.